Take it away, Michelle.
Thank you so much, Amanda. Next slide, please. Whoops, hold on a second. Thanks, Jesse. All right, so our agenda today is I'm gonna do a little introduction of our project team who's gonna be working on this project, talk about John Muir Health, our goals and vision, and then I'm gonna turn it over to Michael, who's gonna go over the project overview and the timeline, and then at the end we'll have some time for Q&A. Next slide, please. All right, so this is our project team, and for John Muir Health, Michael is leading up this team, and I think I saw Jeannie Gomez, our Director of Capital Projects and Design on the call, Jesse Riley, who's our Senior Project Manager and Facilities Development, Ben Drew, who's our Communications Chief. I saw him on there, and then last but not least, Sarah, we were just talking about this. You gotta do it for me.
Say you're great. Sarah Shadakowitz.
Shadakowitz, okay. Yes, our Program Director for Government and Community Affairs. And our design team that we're working on is from the Smith Group. They have helped us with the design of this facility, and then our consultants are for structural, mechanical, and civil are the companies that you see there. So we are really, really excited about the team that we have pulled together for this next phase of our Concord Medical Center. Next slide, please. All right, so this is John Muir Health and the community that we serve. We are the only private independent health system serving Contra Costa County for 92 years, all in all. And we obviously always remain committed to serving and investing in our communities, and this project is part of that. We have been proud to be part of the Concord and Pleasant Hill communities for decades now. And you may or may not be aware that the original hospital in Concord was started, I think almost 60 years ago now, by a nurse, Edna Haywood, who started the first hospital in a house in downtown Concord. And that has since became a district hospital. It became Mount Diablo Medical Center. And then when we merged, John Muir Walnut Creek and Mount Diablo Medical Center became John Muir Health, our Concord campus. We feel an immense amount of satisfaction that we are here to support families who live who live here, and in some of the most joyous, and then also obviously the most hardest moments of their lives. And we're here for all of it. Next slide. This slide shows that we serve 1 in 4 Contra Costa residents. So each one of these dots represents 10 people who we serve. The black dots are those that are commercial, and the red dots are our Medi-Cal population. So as you can see, we have patients all over the entire county and beyond. Next slide. So while we serve individuals in the Bay Area, many of our facilities are located in Concord and Pleasant Hill. And when I think about the work that our team at Concord does every day, I think about a lot of things, but I think first and foremost what immediately comes to my mind is our emergency departments, which are ready to handle any medical emergency that comes their way. Our emergency departments see a really high number of uninsured patients who don't have access to or aren't able to utilize their primary care physicians. So a lot of that primary care work is done through our emergency rooms when patients come in need of urgent services, but maybe not emergent services. And we're at John Muir, we're actively working to find solutions for patients like this so they have access to high quality, equitable preventative care in their community. And lastly, I would say that the heroism that I saw during the early days of COVID, from the emergency room to the nursing units upstairs, by the doctors, nurses, respiratory therapists, nurses' aides, it's just limitless the number of people that were involved in caring for patients during this pandemic will truly be with me for the rest of my life. Each year at the Concord Medical Center and the Concord outpatient facility, as well as the Pleasant Hill Medical Center, we provide care to many individuals across the cities of Concord and Pleasant Hill. And in fact, in any given year, 1 in 3 residents of the city of Concord, as well as 1 in 3 in Pleasant Hill, will receive care in one of our facilities. And in addition to providing care for the residents in the cities of Concord, we're also very proud of the role that we play as an employer here in Concord. Right now, 942 of our John Muir Health employees, almost a sixth of our workforce, live and have families here in Concord. And I'm actually one of those that live and work in Concord. I was born and raised in Walnut Creek. My husband and I raised our boys in Pleasant Hill. And then my husband and I moved to Concord as empty nesters about 7 years ago. And we now raise chickens on our properties until our boys come home to visit us. I actually love Concord. It is just an amazing community that I have felt incredibly welcomed into. And additionally, through our facilities, we bring individuals here to the city every day. About 2,382 employees working in the city of Concord at one of our facilities. We also have 228 John Muir Health employees with whom Pleasant Hill is home, and an additional 151 employees who work each day in Pleasant Hill. Next slide. So beyond providing care, just in general, as a healthcare system that's deliberately made the choice over and over again to keep clinical decision-making local, our leadership team thinks deeply about how we're showing up for this community in which we live, work, and play. We at John Muir truly believe that we are the community, and we are honored to
Yes, this is Wade Cantrell. I'm looking for Habib.
For that community. We could share many examples here, but to provide just a few, during the COVID-19 pandemic, alongside other healthcare systems, our teams made sure that we were here for the community in the time of greatest need. We provided acute inpatient care to more than 5,000 hospitalized patients. We administered over 140,000 vaccines, including 4,000 through our mobile vaccine clinics to disproportionately impacted zip codes. And many of us on the leadership team were part of that vaccination effort going out into the communities to make sure that those who couldn't come to us could get their vaccines. We provided over 300,000 COVID tests and proportionally, John Muir Health cared for more COVID patients than any other health system. We not only cared for patients within our hospitals and clinics, but we also partnered with the county to help stabilize the crisis in our nursing homes. And these crises went sort of cyclically throughout the entire 3 years of this pandemic. And I was joined by other nursing leaders when the very first COVID outbreak happened at a nursing home in our community. We donned our PPE, which is protective personal equipment, and we went into this nursing home to train the staff on how to protect themselves as well as their patients from contracting COVID. And then over the next 2 years, we were active in helping support nursing homes across the county to hopefully prevent outbreaks, but when they couldn't, how to manage them. There were times during this pandemic that my greatest fear would be the collapse of the skilled nursing facilities, and they would have mass evacuations because of outbreaks, which would just have absolutely overrun us with patients. And so through the coordination with the county and other health systems in our county, probably one of my proudest moments is that we were able to keep those skilled nursing facilities functioning during the darkest hours of the pandemic. We also show our commitment through our support of underserved communities. A common misconception is that only individuals with access to commercial insurance use our facilities, and that's just simply not the case. Right now, 70% of our patients have their coverage come through a public insurer, whether that be Medicare or Medi-Cal. And in 2021, of the 10,675 discharges that took place at our Concord Medical Center, 21% of them were for patients who received coverage through Medi-Cal. So we fully believe that it is our mission to take care of all patients in our community. We also show up for communities by providing hard to source but essential services like inpatient psychiatric care, particularly for children and adolescents. Right now, across the state of California, there are less than 100 pediatric psychiatric beds, and 10 of those are housed in Concord at our behavioral health center. That is 10% of the total pediatric psychiatric beds in the state are at John Muir Health. That's a staggering number to me, and it also shows how under-resourced this is across our state, and the demand for these beds is only increasing. While these types of services can be hard to maintain, our board of directors has chosen to continue to do so because we believe it's essential that patients have access to these types of services close to home. And furthermore, through our acute inpatient psychiatric services, we provide care to many individuals from underserved communities as well. For example, from 2019 to 2021, John Muir Health provided care to 1,056 patients ages 4 to 12 and 2,859 ages 12 to 17. And of these patients, 53% received coverage as a Medi-Cal beneficiary. Finally, while we know we have an important role to play in the community, we know that we cannot do the work of promoting health alone. And we work with a broad variety of organizations based in both Concord and Pleasant Hill to help address underlying social determinants of health, including groups like the Putnam Clubhouse, which provides individuals with significant mental health diagnosis and peer support services, Monument Impact, which provides services of many varieties to underserved communities in Concord and the surrounding area, our school nurse program, where we partner with Meadow Homes and Cambridge Elementary Schools in Concord to ensure that students have access to the care they need in school settings, and the Center for Human Development located in Pleasant Hill, who we partner with our Beyond Violence program, which is a program to slow and or stop recidivism in violence when we get trauma patients as, that have been involved in violence. Next slide, please. And lastly, this is just a slide, and I often look at it and, you know, people say, oh, is that your brag slide? That's all the awards and recognitions you have. But truly, when I look at this slide, it's what I feel makes John Muir, and we are always looking for ways to improve the care that we give to patients. And through many of these programs, we're recognized for that work that we do, but it's also through programs like this that we learn new and innovative ways to continue to deliver care. Just a couple of the highlights: U.S. News and World Report for 22-23, we were hospitals number 2 and 3 out of 50 in the San Francisco metro area, UCSF being number 1. So makes our partnership with UCSF even more special, that within that partnership, numbers 1, 2, and 3 in the San Francisco metro area. Health grades among 50 best hospitals for cardiac surgery at Concord. Our cardiac surgery program is known across the United States. We have had people come here saying they have heard about our cardiac program, and we have an incredibly dedicated team for this. And they, in addition to the health grades, it's also the top 5 hospitals in California for cardiac surgery. Newsweek, we are again ranked very, very high across the United States. And lastly, Magnet recognition for nursing. Magnet status is a designation that recognizes excellence in nursing through patient outcomes, as well as a great place to be a nurse. Generally, it's a great place to be a nurse. It's a great place to get care. And that, I think, is the end of my portion. And I'm going to turn it over to Michael Minaldo, who is heading up this enormous project that we're heading into.
Hey, Michelle, thanks for giving such a great overview. Before I start, I might want to take just a pause if anyone had any specific questions for Michelle right now that are burning. Otherwise, we can move on.
Yeah, I got a question for you, Michelle. My name is Palo Walker. I'm just curious. You said you have set 10% of the available pediatric deals at your hospital. My question is, so all the schools a lot of the schools are closing down and there's less funding for schools. So because there's less children going to the schools because the population is dropping. So I'm just curious, like, not that you have anything to do with one or the other. I'm just, obviously, if there's a bunch of kids being born in John Muir, they're going somewhere. So I'm just curious, are you noticing a drop? Or just because you have 10% of all doesn't mean you're not noticing a drop in rate? So I'm just curious about that.
Yeah. So the 10% is actually the pediatric and adolescent psychiatric behavioral health beds in California, not the pediatric beds. That being said, we actually have, during the COVID, just kind of as an aside, during COVID, we saw a huge decrease in the amount of patients that were hospitalized, pediatric patients. A lot of it was that they were isolated, they weren't being exposed to the various viruses. We actually right now are seeing this incredible boom in hospitalized children right now. because, being back out and about, and there's all these viruses they haven't been exposed to yet. So we're having a really, really busy summer and winter. In addition to that, our birth rate is actually on the increase within John Muir Health, although overall in the state and in the country, it's down. But our market share at John Muir, we actually, the last 2 years, have had the 2 highest years of birth rates that we have seen. So it's great for us because it means that families are choosing us, to start their little ones' lives, being born. So
Thank you. Appreciate
that
it.
answers your question.
Anything else specifically for Michelle, or we'll go ahead and get started? And I apologize, my voice is a little bit more hoarse than usual today. Van Morrison was playing at the Mountain Winery on Sunday night, and at 77, he can still do it. It's pretty amazing. So this slide speaks a little bit to the overall goals and vision that Michelle spoke about the exceptional care we provide. I want to talk specifically about some of the goals for the project itself. From a facility standpoint, we have a regulatory requirement. All hospitals in California have to meet a seismic requirement by 2030. There were a series of deadlines we had to meet, and we are compliant with those, but the big one is in 2030, so we want to make sure we maintain compliance. From a policy perspective, it's a good thing. The state said in 2030, all hospitals have to be able to remain fully operational after an event, not just the structure, all the utilities, and everything that goes with it. Unfortunately, it's an unfunded mandate, and all the hospitals are struggling to get the investment to where it needs to be that we can meet that. The other part is, regardless of seismic, we want to reinvest in Concord. As Michelle mentioned, it goes back 80 years at this point to a small house, and it grew over time. And this is a great opportunity to actually consolidate and modernize the campus. It grew, some portions are very underutilized or antiquated, and then we need to replace some of the key elements, including our surgery suite, all the support space, materials management, and our imaging department. So we're looking at how we do that in the most comprehensive way. And frankly, it's a great opportunity I'll point out later about how we're restructuring the campus. One of which is creating a new front door. Right now, if you go to our Concord Medical Center, you may have trouble figuring out which one's the front door, and we'll go through that. And then talk about how we're aligning the design with the overall brand. We are a health system. We're not, Walnut Creek. We're not Concord. We are a system. We want wherever you go to get care, you have the same level of expectation about where that's being delivered. My team is really honored to work with Michelle's team, this incredible group of clinicians, and they provide absolute world-class care. And we want our facilities to actually be able to support that and actually do it in a way that's world-class. That doesn't mean expensive. It means really carefully thought through on the patient experience, how we receive those patients from the first phone call to the arrival at a doctor's office or at the ED or showing up for a scheduled surgery. Next slide, please. So part of this goes back to, as we were doing our master planning, and we updated that significantly in 2018, what's changing in healthcare? Obviously, COVID-19 threw us all for a loop. And while we gotten to a COVID normal, and it's in our daily lives at this point, it still has fundamentally changed the way we deliver care, both in terms of volume and the precautions that we have to take. And then there's ongoing changes in policy at the state and federal level that affect us. And then just in general, a rapid shift to outpatient services. We've done a lot in the hospitals over the years that could potentially be done in a better environment relative to what we're treating, and also in a more cost-effective environment. When we have patients coming to an emergency department for something that should have been handled at a primary care level and it's gotten bad, that's not a good thing from a policy perspective. And then we're also looking at what's it really mean to be an integrated health system. Shouldn't they look at it? We're actually implementing what it means to be an integrated health system, from the continuum care, from primary care when you're first having your baby, through the middle years and all the way through the end. And then we're doing part of this, and Michelle touched on, we want to be locally governed. This is absolutely a foundation stone for our board of directors. And to do that, we actually are forming a series of strong alliances. Even if we had all the capital in the world, we couldn't grow fast enough. And we have to deliver care at a scale that is commensurate with what it takes to be efficient. And we've picked some incredible partners. Michelle touched on UCSF, both in terms of having an insurance product through Canopy Health, but more so now with our East Bay Cancer Network, which is a joint venture of John Muir and UC. So now at a community level right here in Concord and Walnut Creek in Contra Costa County, you can get access to the same protocols, the same tests, and the same studies that you would get as if you're going to UCSF. And our goal is to keep everyone from going through the tunnel and across the bridge and delivering as much as we can right now. And then when Michelle talked on pediatrics, Stanford Children's is our partner in pediatrics. And again, providing access to incredible care, but keeping it here in Concord and Walnut Creek is absolutely really, really important to us. Next slide. So we looked at that master plan. One, we're trying to design and build things over the next 5 and 10 years, but we have to think out what are the long-term directions for these campuses, and setting up to phase development over a 30 to 50 year window. And obviously we're always trying to solve for the operational issues. Fortunately, Michelle's team is always innovating and improving the way they deliver care. And we're trying to find ways where we can make the facilities flexible enough to deliver that care. We have lots of strategic issues we're trying to get to. How can we drive more patients out of the hospital into outpatient settings? How can we do video visits, other things to make care more efficient, more affordable, and improve the access for the community? I think it was interesting during COVID, we had been piloting some video visits in our physician network, our outpatient group. And, overnight we went from a few hundred video visits to thousands of video visits in like 3-week period. To a certain degree, there's some advantages that have come out of COVID. I've never want to go through it again. Didn't wish it came, but we've learned a lot about different ways to deliver care and how nimble we can be in doing that. And then obviously when we're looking at hospitals and the expense of building those, we want to use them for the highest and best use. So as we're redeveloping the Concord campus, we're actually looking at what needs to be in the hospital building versus what can be someplace else. We have some administrative services that are in the hospital that as we redevelop and rebuild, we'll find more appropriate space for. And that gets us the best use. And then for an ambulatory side, really marrying up our real estate strategy and where we want to be geographically with the growth strategy for our ambulatory network. And again, the same issue about highest and best use, making sure we're utilizing everything fully before we set up new sites. Next slide, please. So Concord, this is a great spot for us geographically. Right off the 242, easy access from East County, easy access from Central County, off ramp right at Grant Street, a few minute walk, 15-minute walk from Todos Santos Square. And I wish the BART station were a little bit closer, but technically it is walking distance. So we have this great opportunity to be a hub right here in Concord. Next slide, please. So this is a view of the main campus, and what we refer to as the North Campus. The main campus is the hospital building and campus itself. We were originally founded and grew over time. Our North Campus has our behavioral health center, inpatient facilities on it, and what we refer to as 2700 Grant. It's a medical office building that was built in the late 80s, and that we're going to be doing some work too on that campus. And then we have what we refer to as our East property, which we're not redeveloping right now. I was raised in a Catholic health system. The nuns always taught us, if there's land adjacent to your campus, buy it and just have room for the future. And when we say future, we're thinking 30, 50 years. In fact, in our case, it's 2099. Our agreement goes with the city of Concord for the campus. So, we take it like we own it. One thing about the main campus, if you look at that, the main campus is 3 city blocks. And while there's a couple of towers on it, most of it is 1 story over a basement. Really inefficient, grew over time, and we have this great opportunity to solve it, make it more compact, and we're going to take advantage of that. Next slide, Jesse. So this is the campus in approximately 2030, 2032. We're actually taking the opportunity to reorient the front door of the campus that's currently into the A building off of Almond Avenue, and bring that out onto East Street and make that the primary entrance for everything onto the campus. And I'll be showing you, we're going to create a big entry plaza there and actually make our parking more accessible, both for patients and staff. If you ever tried to park there, one lot's full, you have to drive out, go around the block, and we want to try to solve some of that. And then on the North Campus, adjacent to the 2700 grant, we're going to expand for our specialty services. We'll have our outpatient imaging, which today is in the hospital, but again, going to highest and best use. A lot of that can be outside the hospital. We're going to be moving it. We're going to be looking at some outpatient cardiology services and a potential ambulatory surgery center over there. And when we think about that campus, we think it'll look like two buildings. We think of it as one complex, and it's going to be for primarily for specialty care with a little bit of primary care, and we'll be expanding our advanced urgent care over there. So as Michelle spoke to, the number of patients that come through the emergency department that really don't need to be seen there, and if they can't be seen at primary, we want to give them a more affordable, more appropriate access point through urgent care where they can do the diagnostic tests, but we don't have to have you in the emergency department. Next slide, please. This is an aerial view you can see today on the right side. The Hoffman Tower was built in 2010. And then next to that is the A wing, which was built in 1984, 89. And then the B wing, what we refer to, is built in the early to mid 70s. And the campus gets older progressively as you move over to the campus. If you think about the A wing and everything north of it, that's what we're replacing. And it's a tight campus. I'll show you about how we're going to do that. And then the same thing on the North Campus. We had something called the Williams School that sat between behavioral health and 2700 grant. It was an old grade school, I guess, of the Williams School. And it's seen better days, and we raised it in 2020. Before we did that, we actually moved our outpatient behavioral health to a wonderful site on Port Chicago Highway. We took the entire building, 20,000 square feet, and greatly expanded those services. It's accessible from the BART, accessible on bus lines and the freeway. Next slide. So this is our view in early 2030. As you can see, we took away most of the buildings on the main campus, and we replaced them what we refer to as the new tower for right now. And behind that is a new central utility plant. This is a complex campus, and it was really hard to find a clearer site to build. So our central utility plant, think of the boilers and chillers, is antiquated. It's going back to the 70s. We're going to replace that up against the BART tracks in Port Chicago Highway. And when that's done, we can remove the existing central utility plant and loading dock, and we'll build, excuse me, the new tower. And then we'll create the site in front with all the parking and solar panels for easy access. Now, when we're going through our entitlements with the city, this is the full extent of the development. We don't have another project right behind it, but we are thinking for 2050, 2075, it would be easy to add another wing to this building in the future, this campus in the future. Now, the North Campus, we're planning up to 3 stories adjacent to 2700 grant, and the site's been cleared for that. And it's just a matter of timing when we have to phase building that in before 2030. Next slide, please. So this is a little bit cleaner view. You can see coming in off of East Street, one main entrance and sort of roundabout entry garden right in front of the main door. From that main door, you can get to the A wing, and you can also get to the Hoffman Tower. You can still come in on the south side of those, but that is intended to be the main drop-off. Registrations there, access, control, and we can sort of help manage the population a little bit easier. And then there's easy parking right out in front. And then to the left, one of the goals was to maintain surface parking for this campus, at least initially. And then behind that, you see the central utility plant. And actually, this is a really interesting time to be building a plant. Natural gas has been our go-to. As the state's electrifying, we're actually looking to see, can we go close to all electric? And right now, our plans have us about 80% electric. We're using thermal energy storage tanks to allow us to do that, where we can heat and cool the water for the building off hours, and we can do it electrically, store it, and then use it during the day. And there's a whole host of other things we're doing to make this building sort of as carbon neutral as we can. Healthcare is going to be one of the last to get there, but we're trying to lead the way on how it can be done, and Concord's a great opportunity for that. Next slide. And this is the sort of aerial view of what that's going to look like. Again, you can come in the main entry off the East Street, come around for a nice gracious drop off, and then easy to find parking when you come back to pick up the patient or visit while you're there. You know, it's funny when we talk about the main campus a bit, I lovingly refer to it as the Winchester House. I've been here 15 years, and there's places I still can't find. And I'm not being critical, it's just built over a very long window without a clear master plan. We had this in other sites too, and this is a great opportunity to unwind it. And you can see there a little bit different view on the Port Chicago side. I'm seeing the patient rooms on the back. This building on the basement level is support services, materials management, kitchen, lab, pharmacy, and then easy access from the loading dock and a below grade connection. First floor of the hospital is mostly imaging and our administrative services that have to be on the campus, and some other things. Second floor is our surgery suite. So we're going to rebuild our existing surgery suite that we have today, and we're expanding the number of procedure rooms and the capability, and they'll all be modern, right? Some of these go back to 1970 and they need some love and attention. And then we can build up to 3 stories of patient beds above that. We're still determining the right amount, but we're going to entitle the full amount for going forward, and we'll work on that while we're designing it. And then the central utility plant, you can see the thermal energy storage tanks back up against the BART tracks. And then we've screened the equipment. And from a placement perspective, it's kind of an easy decision to put it up against the BART tracks, just because any noise coming there would be offset with the BART right there. But we didn't treat it like a back door, because we have how many of our 100,000 people on BART a day, they're going to see the cup, and we want them to have a good impression on that first sort of drive-by. Next slide. So this is on the North Campus, where that new outpatient center is located, was the footprint of the Williams School, which is a 1-story building with a courtyard. And then we're going to have a link between the new outpatient center and 2700 Grant. So once you enter the facility, regardless of which wing you're in, you have easy access to all the services, and then we'll keep the patient parking out in front. And that's our behavioral health center back in the back. Outside of what we're redeveloping now, we actually renovated both patient floors in that building. They sort of needed to be redone. We improved access and controls, greatly improved the finishes in the building and the safety, frankly. You know, it's really sad, but one of the things you have to deal with is the reality. And there's an anti-ligature change. And anti-ligature means you're trying to find ways to make sure someone can't be creative and take their own life. And it's an incredibly hard task to do. We've invested a lot to make sure we're on the leading edge of that level of safety. Sorry, I'm pausing for a second because my screen timed out and I can't see you. There we go. Sorry about that. In both the buildings, we are being really cautious about the context in which we're building it. In terms of the outpatient center, we've done some things, and you'll see, to break down the scale, but especially on the neighborhood side of the building. We changed the finishes so the top level is a little bit different and won't seem quite as large a building. Next slide. So it's a view driving in that driveway today that leads to an empty site, 2700 Grant to the right. And that's 3-story modern outpatient center. And when you think about the amount of high tech that's going to be in there between our imaging department and PET CT, a potential outpatient cath lab. So think about the cath procedures that are done today in the hospital. A lot of those are outpatient. And by moving that additional volume outside the hospital here, we can provide the same level of care at a lower price point and make it be quicker in and out for the patients. And then the 3rd floor, we're leaving flexibility for what we don't know today. Next slide. this is a lot to get done by 2030, and we'll show you it goes a little bit after that. That's that 2030 mandate. Right now, we're up in the entitlements. We're getting approvals from the city to build what we need to build. Fortunately, our entitlements were in pretty good shape, what we already zoned to do, but we're having to refine those a little bit, and the city has been wonderful working with us. When we're sitting at not a table, we're all on Zoom together. It would be hard pressed if someone got onto that call to figure out who works for the city and who works for the design team. It's great interaction back and forth. The first two physical work we're going to be doing is the make ready work, moving utilities and clearing the sites to start the first big project. And then we get into the central utility plant, which we're hoping to start in late 2024. And that'll take about 2 years to complete. And then as soon as that's done, we take down the old central plant, and then we start construction on the new hospital tower, which will finish up right before the deadline. And then we have some demolition and site work to do after that. So the campus, I don't want to say torn up, is going to be very impacted for a period of time. And like last time, we'll do off-site parking, we'll manage that, and we're going to be working really hard with the community to make sure we minimize our impacts. And the good news is we don't want to impact our patients, and what we do to protect the patients will protect the neighborhood. And then down at the bottom, you'll see sometime in around 2025, 2026, we'll be doing that outpatient building on the North Campus. That can float a little bit, and we're working with the business about, when's the right timing for it. So I'll take a breath there. We are doing good on time. We've left just about 15 minutes for Q&A.
Debbie, go ahead.
All right, thank you. Wow. What can anyone say, but wow. First, I apologize for being a little tardy to the party. I think I had it on my calendar for 4:30 and went back to look at when I figured out I didn't have the Zoom, that there was an email that said 4, so my apologies. I wanted to comment, there's a lot I want to say. First and foremost, I appreciate John Muir deeply as a community partner, but also I can't tell you how many times I've texted Sharon and said, I have a friend in the hospital, I have a friend here, I have a friend, I have this going on. We need more nurses for mobile vaccine clinics for frail elders. Like any kind of call, text, touch is responded to in a really meaningful way. And there's a lot of positivity. I personally switched to John Muir Care through my husband's insurance after being a Kaiser person almost my entire life, and have had incredible experiences. So all across the board, I'm super appreciative and grateful for John Muir. So that up front. I also, as in terms of my business, Choice in Aging, we're a nonprofit organization located in Pleasant Hill, and we serve frail elders, not just in Contra Costa, but in other counties as well, but with a goal of keeping people living in the community with dignity and choice. And we were the recipient of a bunch of your furniture from when you moved the emergency department in the Concord location. And when you said we want to use our highest, best use of our facilities, I wanted to just remind you that as you're making those decisions and divesting yourself of not highest use items, you have lovely local nonprofits in the community like Meals on Wheels Diablo region and like Choice in Aging, who will gladly take your furniture and various other items. So I just wanted to put that out there.
Duly noted.
Yes. And I would just also offer up that we would love to support the work that you're doing. And if you are presenting before city council or planning or architectural review or things like that, and you feel like you need support, please reach out.
Thank you very much. We will get out to this group. We have an upcoming design review meeting. We've had a couple study sessions with them. Those have been great. But if you want to show up and support, that'd be wonderful. And Jesse, we should get out the planning commission meeting. Fortunately, we shouldn't have to go to city council unless it gets appealed. And so far, we haven't had anyone opposing or expressing concern about what we're developing. But thank you.
Does anybody else have any other questions? No? Okay, I will go straight into announcements. Caroline or Lisa or any of the elected official or reps, do you guys have any information that you would like to share today? Go ahead, Lisa.
Go. So of course, I just want to highlight that we still do have some COVID testing locations here in the county. Some have started to go offline as things wind down, but the state still has the DVC overflow parking lot, and then the county has one in Concord and 2 in Martinez for this, general area. Of course, the Omicron booster is available. And I'm going to put a bunch of links in the chat. So if anyone needs to grab any of this information, it'll be there. So the Omicron booster is available. And if you are going to a county site for an Omicron booster, you can request a flu shot at the same time. It's voting season, elections coming up. So everyone should, as long as you're a registered voter, receive your vote by mail packet. And if you have not received it, I've got a phone number you can call, or you can reach out to me directly to make sure you get a copy of it. The drop boxes are open, the postage is paid, just make sure you sign them. And then lastly, the county will be hosting our MLK ceremony in January, and we're looking for Humanitarian of the Year nominees. This will be 1 student and 1 adult leader. The deadline is November 4th. So if you have someone you'd like to nominate, please grab the link that I will be dropping in the chat for that as well. Thank you.
Hi guys, I'm Caroline with Assemblymember Grayson's office. We don't have too many updates at the moment. We had a successful senior scam stopper event last month, actively working on next year's legislative package, and we've also been working with county agencies on getting the Green Empowerment Zone up and running. So if you want any more details, just reach out to our office.
Kaylee, I don't know if you're still there, but if you want to hop on, please do.
It may have just been me, but it sounded like you said Haley, and I know you said Kaylee, so I just wanted to make sure that Kaylee heard Kaylee in case she is around.
Thanks, Debbie.
Hi, thank you. Thank you so much for clarifying, Debbie. So yeah, if for those of you who don't know me, my name's Kaylee. I'm a district representative with Congressman DeSonier's office. I don't have any questions or specific updates to provide, but as always, feel free to reach out to our office if there's anything we can do to help on the federal level. And thank you so much to everybody from John Muir for presenting all that information today.
Thank you. Before I wrap up with Concord Chamber updates, I do want to make sure everyone knows we are partnering with the Pleasant Hill Chamber today for this meeting. So Steve, if you have any updates for Pleasant Hill that you would like to share, please do.
Thank you. Just that we had our candidates night for Pleasant Hill City Council candidates back a couple of weeks ago. And yes, remind everybody, it is voting time. I got my ballot in the mail. So now it is time for everybody to do their voting. And I want to turn it over to Derek Knapp. He's the president of our chamber for additional updates. Derek.
I'm sure the ladies from Concord will probably also chime in about our joint mixer coming up, but I'll let them do that. I'm glad to have the new facility in Pleasant Hill from John Muir. I extend a hand if any of you from that facility would like to become part of our board here in Pleasant Hill. We would love to talk to you about that opportunity, and so reach out to me or to the office.
All right, so quick updates from Concord. As Derek said, we are hosting a 5-chamber mixpo, a mixer and an expo on November 10th from 5 to 7:30 at the Pleasant Hill Community Center. There will be about 50 vendors there, so you definitely want to come. We are sold out here at Concord, and I think Pleasant Hill is too. So if you are wanting a booth and you are part of another chamber, you can still go to them to purchase booths. So it is Concord, Pleasant Hill, Martinez, Lafayette, and Walnut Creek. So a lot of good networking there. Like I said, even if you don't have a booth there, you still want to come network. A lot of opportunity there. We'll have food there from each of the chambers, and some beverages as well. So that again is November 10th. It's a Thursday from 5 to 7:30. The Concord Chamber, we have a mixer on Thursday of this week. It's a ribbon cutting / mixer. Red Dog Graphics is introducing fast signs to their business. So we're celebrating that joint venture between the two, and then we'll be having a mixer afterwards to mingle and learn a little bit more about each of those businesses. And again, all of this information is on our website. Pleasant Hill has their information on there. So if you're interested in learning more, you can always visit our 2 websites. Something big that we are partnering with the City of Concord on is the ARPA Small Business Reimbursement Grant. So for those who have been around for a while, you might remember over the past 2 years, we've worked with the City of Concord to administer 2 rounds of grant funding in the past. This one coming up opens on November 7th and closes November 18th. And that is for small businesses who are still continuing to have impact from COVID. We have all of the guidelines on the website. Amanda will put it in the chat and we'll send it out to everyone as well. So that will be $925,000 this round and $925,000 in a second round next spring that we will be giving out to small businesses again who continue to face hardships because of COVID. We will also be having a webinar for it on November 1st at 3 p.m. on Zoom. So you can attend that. You can learn a little bit more. We will have FAQs up hopefully soon. We're getting them translated right now into Spanish so we can put that into another language as well. Most of the materials will be in Spanish. So if you know businesses that are Spanish speaking and are interested in that, we do have that material. Of course, everyone is welcome to, again, join the webinar, learn more, but also apply for that. We have all of the guidelines up. Small businesses under 25 employees, there's some other criteria as well as home-based housekeeping, as well as landscaping and gardening and home-based family child daycares. So again, all of that information is online. I know there's a lot of moving pieces to that, but we're happy to partner with the City of Concord for this. We know our businesses are still needing money to help them recover from COVID. So we're happy to help them do that. And with that, I think that's for the most part what we have coming up. Does anyone have any questions before we wrap up? No? Great. Well,
I do. I have a quickie. Is it possible for me to get the slide presentation?
I'm going to defer to the John Muir team for that.
Yeah.
Anybody on the John Muir team?
Let me think about it. We can send it to you in PDF, but not in PowerPoint.
That's fine. PDF is fine.
Okay.
Yeah.
And as a reminder, this was recorded. So if you want to rewatch the presentation, or if there's someone that missed it and they wanted to attend and watch it, please go ahead and send them the link. We'll have it uploaded on YouTube, hopefully by tomorrow, if we can get it all correct.
And I just, I want to thank John Muir for the presentation. I'm Tamara, chair of the Government Economic Committee, but this was, well, all of our kids were born at Concord Community Hospital. So when it was I remember when it was a one-story building, then I remember when they put the second story on. And when I go now, I can't find any of the original, I don't know where any of the original pathways, but there's a whole, if anybody is in the neighborhood, there's a whole wall in the Concord, John Muir Center in Concord, a whole wall of photographs showing the history of Concord Hospital. So all of those pictures of when it was, you know, one Charmetta man, I don't know if anybody knows him, but Charmetta was born there when it was one hospital. I mean, one building, one house. But if you want to see the explosion of John Muir Medical in Concord. That's a good place to see it. In the, I don't even know which hall. You have to follow the yellow brick road or ask one of the security people, because they will take you there. They will not direct you. They will say, oh, let me show you where it is. And then they will come back and get you and show you how to get out. So it's, but I really appreciate your time. The history of John Muir is great, and Concord Hospital, and excited about this expansion. It's gonna be beautiful.
Thank you. It's our pleasure.
All right, everyone. I hope you have a good evening. Thank you again, John Muir, for presenting. We'll send out all the links to the information as well as this video as soon as we have it. And I hope everyone has a good evening.
Thank you.
Thank you.
Everybody.
Bye-bye.
Thank you.